One of the biggest requests that we've heard from workers across the state is around the ability to take Washington's long-term care benefit with them if they move. We want to make sure that we have the flexibility that if people do move, that they can take the benefits with them. My bill, which is House Bill 2467, just was moved out of the Senate Labor and Commerce Committee earlier today. It would give anyone who leaves the state after 3 years of in-state qualifying contributions the ability to elect portable benefits coverage by agreeing to continue to contribute premiums as long as they are still working. This means that workers in Washington who move to Oregon or California or Maine or wherever can keep Washington's long-term care benefits. It also includes discrimination protections for people to ensure that when they take those benefits out of state, they will still have those protections against age, discrimination against age, race, pre-existing condition, or gender, which is just so important.
If a Washingtonian works at least 3 years and pays into the program and then has to move away to another state, they can opt to continue to pay into it if they want, or they can drop it if they want. But if they retire out of state, they can also keep their benefits. So the portability is really adding to the flexibility of the program for everybody. Because after all, when you move and you have Social Security, your Social Security goes with you.
I am the caregiver for my mother, who's 86 years old and has dementia, and I can tell you it's the hardest job I've ever done. We know that we have about 800,000 unpaid family caregivers in this state, helping loved ones, with daily activities of living, including meal preparation, medication management, getting in and out of the shower, helping them go to doctor's appointments, helping them with their bills, doing the grocery shopping. They oftentimes are spending 20 hours or more a week doing this work, often on top of a full-time job. They also are spending upwards to $7,200 of their own money to help pay for and care for an individual. The challenge that WACares is really trying to address is that gap in care. We know that 70% of people 65 and older are going to require some type of long-term care in the future. But yet, long-term care insurance is often unaffordable. It is biased in terms of if you have a pre-existing condition, it makes it really challenging. A lot of people say, well, I don't need long-term care. I have Medicare. Wrong. Medicare does not cover your long-term care at all. WACares is a benefit that will be there for individuals now and in the future when benefits are first paid out in 2026. WACares Fund helps individuals do what they also want to do, which is age in place and age in their home and communities where they want to be. People want it to go with them. They want to be able to retire in another state or take a job in another state, or maybe they're going to go and they're going to move because they decide that they want to live in a warmer climate, what have you. They should have that ability to relocate and move to another state and still have the promise that WACares is going to be a part of the solution for their long-term care needs.
I cared for my mother, Patricia Keys, for 10 years. She was a very healthy woman. At 62, she passed out and hit her head on the couch, causing her to have a hemorrhagic stroke, giving her 1% chance to live, leaving her paralyzed on one side. That day changed her life, and it changed my life when I became her family caregiver. We did not know that Medicare did not cover in-home care. We did not know that it only covered one piece of medical equipment every 5 years. If Washington Care Funds would have been in place, not only would it have helped us to have about 1,000 hours of care that we could have tapped into, but it also, as Cathy mentioned, would have given us a moment to have peace of mind and make good decisions on how to care for my loved ones. So I'm very grateful this is going to be part of our lives going forward in the state of Washington.
At the age of 19, I was in college. I was living on my own for the first time, and I was getting my first taste of independence, when all of a sudden, my life was turned upside down. I started experiencing things that I've never felt before. Things like extreme fatigue, inflammation, and pain in my joints. So bad so that I ended up quitting school and needing to move home. And later on in and out of the hospital for several months, I was diagnosed with lupus. Long-term care is not just for people that are older or seniors. I'm currently still working and I'm living independent, but my condition is completely unpredictable. Most days I feel good enough, but other days it's tough because the inflammation that I suffer through sometimes in my ankles or feet makes it hard for me to walk my dog or just go to work. Or the pain in my hands are so severe that I'm not able to cook for myself. But why cares, knowing that I can tap into them and knowing that there's an opportunity for me to have people that can come help me out and give me assistance gives me a whole bunch of relief.
I'm also here to let you know that unfortunately things happen every day to everyday normal people. It can happen unexpectedly. You can be very unprepared. When I first found out that I was going to be needing a wheelchair, it was because I went into the doctor one day and followed their medical advice. When I did their test that they recommended, I unfortunately had a very bad, severe side effect and came out with a spinal cord injury. I can tell you now that my family wasn't financially prepared. I was 30 years old and had a 2-year-old son. Now I have 2 beautiful boys, and we're doing okay. But if my husband ever had to cut back his hours to take care of me because I needed long-term care, our family would again be thrown into chaos, financial instability. And that is a situation that most people would find themselves in. Walkers would have been a lifeline for my family back then, but I am so glad it's in place today. Because now I know that when something else arises, for myself, my husband, or either of my boys, Walkers is going to be there for us. And now it's even portable. If we were to relocate, we have that option.